So we start with the SBA and EMQ questions on this vaginal discharge. Doctor, please start with the question number one.
A 28-year-old woman attends the clinic with thin gray vaginal discharge and a fishy odor. Vaginal pH is 5.2. Wet mount microscopy shows clue cells. What is the most appropriate statement regarding diagnosis? So, this is bacterial vaginosis, and AMSEL criteria
Read
on
all
all
the options,
features.
doctor.
Isolation of Gardner vaginalis confirms bacterial vaginosis. Nugent score is preferred for routine clinical diagnosis. AMSTEL criteria require all four to be present. The diagnosis can be made clinically using AMSTEL criteria. BV is sexually transmitted disease. So last option is not correct. And diagnosis can be made clinically using AMSTEL criteria, but any 3 out of 4 should be present. So C is not correct. Nugent score is preferred for routine clinical use. We don't do that. Isolation of Gardnerella vaginalis confirms bacterial vaginosis. So the answer can be D.
Yes, D is the correct answer. Okay, because
Yes.
Gardnerella vaginalis will not confirm this diagnosis. Okay, so AMSA's
Yes.
criteria are used for the clinical diagnosis. At least 3 criteria out of 4 should be present. Culture for
Yes.
Gardnerella is not diagnostic. Nugent score
Yes.
is a research for purposes. Okay, not for routine
Yes.
clinical uses.
Hmm.
Bacterial vaginosis is not a STI. Okay, though it is
Yes.
associated with other STI, but per se, this bacterial vaginosis is not a STI. Go for the
Yes.
question, doctor.
A 32-year-old woman is diagnosed with symptomatic bacterial vaginosis and completes a 7-day course of oral metronidazole. Her symptoms resolve completely. What is the most appropriate next step? Repeat vaginal swab in 2 weeks. Test of cure with Nugent scoring. Advise partner treatment. No further follow-ups required. Start intravaginal clindamycin. So why should we start clindamycin? That is not correct. Advise partner treatment. Test of cure with Nugent scoring is not done. Repeat vaginal swab in 2 weeks. So A is the answer.
No, doctor. If the patient is completed the treatment and if she is asymptomatic,
So
we
no
don't have to
further
do
follow-up
anything.
is required.
No test of cure is required. So option is D.
So
Test of
nothing
cure
is
is not
required.
required if
Yes.
symptoms resolve. Partner
Hmm.
treatment is not indicated for
It's not
bacterial
done. Yes,
vaginosis.
sir.
Further
Yes.
treatment is unnecessary unless symptoms recur. Okay.
Yes. So
Go ahead with the,
patient is
this is
cured. Yes.
EMQ. So this is EMQ.
24-year-old woman presents with offensive discharge. She is diagnosed with bacterial vaginosis. She reports a history of immediate hypersensitivity to metronidazole. She uses barrier methods for contraception and is not pregnant. What is the most appropriate treatment and advice? So oral metronidazole we will not take because she is hypersensitive to that. Neither intravaginal. Clindamycin 2% cream can be used. I think D should be the answer.
So intravaginal clindamycin 2% cream with
Yeah, D.
counseling regarding reduced effectiveness of latex condoms and advice use of additional or alternative contraception during treatment, or will you give oral?
Oral.
Which one is better?
Oral clindamycin. 300 milligram BD for 5 days.
So which one, C or D?
I think C will be the answer
Are you sure?
because
C.
she is using barrier methods.
Hmm.
So this cream will reduce the efficacy of the condoms and Sir, you tell me.
So C or D? Both options drug are correct.
I think C is also correct. D is also correct.
D is the
So
correct
which is
answer, Dr. D. Let's see. Okay. So correct answer is D. She is allergic to metronidazole. So we will be
yes.
using
The
clindamycin. That
D
is sure.
was looking more appropriate actually, no?
Let us discuss now metronidazole.
Mm.
So we are going to use clindamycin. That is sure. Okay. Now you have got intravaginal clindamycin 2% cream is appropriate.
Mm.
But important counseling point is a clindamycin cream weakens
Mm.
condoms and there is a risk
Mm.
of unintended pregnancy.
Mm.
Fluconazole will treat candidiasis, not bacterial vaginosis.
Yes.
Doxycycline
Yes.
will treat chlamydia, not bacterial vaginosis. And partner treatment is not required here. But what is the duration of clindamycin treatment for bacterial vaginosis? It is 7 days,
So
not for 5 days.
7 days and not 5 days, yes.
You got it. So if this would have been a
Yeah.
7 days,
Okay. Then it
then the
was
oral
correct.
treatment would have been, because then if you are not using the alternative treatment, but
Mm.
in that particular case, still, just a moment. Bacterial vaginosis. Let's see the treatment options.
I understood.
Yeah, see, but still they have given metronidazole and the intravaginal clindamycin is the first. So it is always a first line is a intravaginal. Thus, this is an alternative option.
Mm.
Okay, so if these are to be chosen, the intravaginal clindamycin is going to be the first option, and then the
Mm.
oral will be the option. You got it? So there are 2
Yes.
points. This is the first line option, and this is the second line option, alternative option. And another
Yes.
thing was that here it is for 7 days.
Seven
There it
days.
was
Yes.
for 5 days. Okay, so these
Yes.
minor
Mm.
things are very important when you solve the SBAs. Sorry, EMQs. Okay, doctor.
Yes, sir.
Go ahead with the next question.
A 28-year-old woman presents with vaginal discharge and offensive odor. Wet mount microscopy shows a motile organism with flagella. Vaginal pH is raised. What is the most likely diagnosis? Bacterial vaginosis, vulvovaginal candidiasis, cytolytic vaginosis, trichomonas, and aerobic vaginitis. It is Trichomonas vaginalis.
Yes, it is a trichomonas vaginalis. Okay,
Mm.
very clear cut, straightforward answer. Okay,
Yes.
next question.
Then which of the following is considered the gold standard diagnostic test for Trichomonas vaginalis? Then this is nucleic acid amplification test NAT.
Correct, correct. Okay, it is a NAT. So NAT is the
Which
standard. Microscopy sensitivity is low, 45 to 60%. Culture was the previous gold standard. NAT has the highest sensitivity
is
and
the
is the
gold
current gold
standard?
standard. pH and gram stain are supportive but not definitive. Doctor, next
Yes.
question.
Which is the recommended first line treatment for uncomplicated trichomoniasis in a non pregnant HIV negative woman? So in Trichomonas, the first will be metronidazole 2 gram orally as a single dose.
Yeah, option B, correct. Okay. So B option, metronidazole 2 gram orally single dose. Recommended doses are metronidazole 2 gram single dose or metronidazole 400 to 500 BD for 5 to 7 days. Fluconazole is for vulvovaginal candidiasis. The clindamycin is for bacterial vaginosis. Go ahead with the next question, doctor.
A woman with HIV is diagnosed with trichomoniasis. What is the most effective treatment regime? In this case, it will be C metronidazole 500 milligram BD for 7 days.
Yes, yes. Okay, so key concepts I hope you have understood. Okay, so
Yes.
metronidazole 500 BD for 7 days. Okay, studies show single dose metronidazole is less effective in HIV positive women. 7-day oral metronidazole has superior cure rates. Go ahead with the next.
Which statement regarding trichomoniasis treatment in pregnancy is true? Metronidazole is contraindicated pregnancy. This is false. Tinidazole is safe. No. Metronidazole can be used at all stages of pregnancy. Breastfeeding must be stopped. Tinidazole is preferred. I think C is correct. Metronidazole can be used at all stages of pregnancy.
Correct, correct. So metronidazole can be used in all stages of pregnancy. Metronidazole is safe in pregnancy and breastfeeding. However, breastfeeding may be withheld for 12 to 24 hours after single high dose, and tinidazole is contraindicated in the first trimester. Okay.
Sir,
Now,
after loading dose of metronidazole, we hold the breastfeeding for 12
for
or
12 to 24
for
hours, that is
24
recommended in
hours.
the,
But
yeah,
if you give
12
it
to,
in divided doses, then there is no stopping of breastfeed.
yeah, single high dose they have mentioned. So when you are using 2 gram as a high dose, no, that time it is mentioned. Okay.
Okay. So these are
Uh,
extended matching questions.
These are actually very simple. Only 5 options are there. You'll be able to identify, but we'll just finish it. Okay.
Where are the
So,
questions?
yeah. Hmm.
A woman has thin, homogeneous discharge, fishy odor, raised pH, and clue cells. So this is bacterial vaginosis.
Yes, correct.
Microscopy shows motile protozoa with flagella on saline wet. Partner is asymptomatic. This is trichomonas.
Correct.
A woman presents with intense vulval itching, thick white discharge, normal pH, and pseudohyphae. This is candidiasis.
Yeah. Okay. So all 3 options are correct. Okay. So Trichomonas vaginalis, motile Trichomonas plus flagella. NAAT is the gold standard. Treat partners regardless of the results, and no routine test of cure is required. And with nitroimidazoles, alcohol is to be avoided. So these are the points which we will remember. So that finishes our SBA EMQ session also. Thank you.